Hello friends, this is Jason Williams, DO. This is the Williams Family Medicine channel for patients and healthcare providers that want to learn more about HealthSpan. Today's video is about what to expect when you change to a low-carb, high-fat lifestyle. If you have obesity, metabolic syndrome, or type 2 diabetes, and I have recommended a low-carb, high-fat lifestyle for you, they would like you to know what to expect when you change to this type of lifestyle. First of all, the insulin level that is elevated in these conditions often will go down. When this occurs, it's common for your body to lose fluid and salt. When you lose fluid and salt, this can result in dizziness, headaches, weakness, palpitations, fatigue, decreased exercise tolerance, muscle cramps, and constipation, to name a few. In order that you do not experience these symptoms to a severe degree, I recommend that you drink more fluid than you're used to. I also recommend that you add extra salt, either to your food or even adding a half or a full teaspoon of salt to a cup of water 1 to 2 times a day. There are certain foods that contain a lot of salt. You can also add these, like beef bouillon cubes, pickles, etc. In order to reduce muscle cramps, I recommend patients take magnesium supplements. 400 milligrams daily is often enough. Some people do experience constipation, and an obvious choice is milk of magnesia since it has magnesium in it. Keep in mind, the more aggressively you switch over to low-carb, high-fat lifestyle, the more likely you will have these symptoms. If you gradually ease into this lifestyle, you may not experience any of these symptoms. If you do have some of these symptoms, it's common for them to resolve within days to a week. The one caveat is exercise tolerance. Until you're fully fat adapted, it would not be uncommon for you to have decreased exercise performance for weeks to even a few months. If you have a competition that you've been training for, I recommend that you complete that competition before you switch over to this way of eating and lifestyle. Give your body a chance to adapt. Some of the conditions that patients have make it more problematic when they try to switch to low-carb, high-fat lifestyle. Kidney stones, gout, pancreatitis, severe constipation, hyponatremia, or low sodium. These can all be problematic and intensified if you switch to low-carb, high-fat lifestyle. It doesn't mean you can't switch to this type of lifestyle, but just a precaution. It is not uncommon for people that switch to low-carb, high-fat lifestyle to start having nausea or decreased appetite. This can throw you off if you're not expecting this. If you do experience this, listen to your body. It's best to not eat if you're not hungry. This nausea and decreased appetite can be secondary to a reset of your hunger hormones to a proper level that you're not even used to. When you're not experiencing hunger, this can make it very easy to start implementing intermittent fasting as well. The combination of low-carb, high-fat lifestyle and intermittent fasting can be very powerful for reversing obesity, metabolic syndrome, and type 2 diabetes. I hope these tips are helpful for you in understanding what type of effects you may have when you switch to low-carb, high-fat lifestyle. This information is medical information, but not intended to be your personal medical advice. You need to see your own doctor to discuss your own medical advice. Stay tuned for next video. Have a good day.